everyone. Just wanted to go over our information from last week. I hope everyone had a great weekend. And last week we talked about revenue cycle, and we had an interesting discussion in the discussion boards. I'll talk a little bit more about that in a second because I did want to share some info regarding ClearBalance, which is an interesting company that I happened to run across, I'm sure there are many others like it, but it was one that I just happened to. I didn't work with them, but a finance division that I was working with happened to be working with them. So I'll talk a little bit more about that in a second. But I just wanted to share. Revenue cycle is obviously really important in the patient financial realm. So I just want to talk about that for a second. When you think about revenue cycle, I always think about it's from 0 to 0 on an account. So it's from the birth of the account until the death of the account. So from the minute that the patient actually makes an appointment all the way to the minute that actual account goes to zero balance again. So birth of the account to the death of the account and everything that happens in between. So it's not just the finance side of it, but everything else from patient registration to the clinical aspects of it. So what are the things that are being done clinically for that patient? Everything that happens in conjunction with that. So it may not actually be the clinical care, but what happens with regard to that clinical care, the supplies that are being ordered that touch that patient. What happens with those? Are they being charged appropriately? There are revenue cycle implications there. Are the all of the services that are being provided to that patient, are they being captured? Are they being charged correctly? Are they being coded correctly? There are revenue cycle implications there. And then obviously we had talked last week, I think it was, about fraud and abuse. So from a clinical aspect, are the services that are being rendered, are they actually appropriate? Are they medically necessary? Are physicians charging for, providers charging for things that are inappropriate? And we've seen hospitals and physician practices that are charging for things or doing things just for purposes of making money. Pill mills and hospitals that are doing services that are not required, not appropriate, just doing that for purposes of defrauding the government or defrauding payers to make cash. So that's how that clinical side really then ties to revenue cycle. And then obviously when you move from that to the billing aspects, accounts receivable, that's when you really jump back into the finance side. And we talk about credit to patients, all of that, all the way to that zero balance piece. So from the birth of the account to the death of the account, and I'm missing a million things in between, but those are kind of the heavy hitting things that we can think about from revenue cycle. So I did want to just show you. I'm going to jump to this, and I talked about it in the discussion board, but again, because there are so many aspects of our discussion board, so many students, that obviously not everybody gets to see everything. But this company, ClearBalance, prior to coming to academia full time a few years back, I used to work in consulting education, traveling around traveling around the country. I used to do some work for an organization called Navant in North Carolina, and they happen to use this particular organization. And I'm going to go here. This ClearBalance, what they'll actually do is come in and offer these loans, these lines of credits. They're not loans, but they're lines of credit, and they offer some zero interest options for patients. They also offer low interest options, probably for folks that don't have as high a credit score, but it's different opportunities for facilities, and then obviously it can help that hospital to decrease their bad debt, but also immediately receive payment. So the hospital will immediately receive payment, and then it's up to this these folks, Clear Balance, will be the ones that will then take over kind of that accounts receivable, because they'll be the ones that'll be collecting payment from the patients. So it's not a collection agency because they're not selling, and we'll talk about this. One of our quiz questions talks about this. They're not selling the accounts like you will see sometimes happen. What this is it's really a loan for the balance on that account. And in this case, it happens to be a loan for zero interest or a loan for a low interest rate, depending on what happens to be appropriate for that patient. So this really happened for Navant, and actually there's, let me see if this is, there are some articles here specifically, yeah, here we go. Navant actually, of course we're going to get an ad first, but Navant had some, no, this isn't a very good article about it. Navant has had some pretty good success with, it's probably this Modern Healthcare article, and I don't have a subscription, but there is some pretty good no, I don't want to do that either. I'm not having very good luck here, but there's some pretty good information out there about how this has been successful. So when we talked in the discussion boards about, do you want to have in-house kind of a financing in-house done for your patients, or do you want to kind of farm that out to an outside finance agency? This would be that outside finance agency. So this is not a collection agent. That's an entirely different type of situation. That's when you're selling your accounts, and we'll talk again. I'll talk about that in the quiz questions. This is like offering, as some of you talked about, like if you go to an emergency vet, or often dental organizations, dental agent or dental practices will offer this, or like folks have LASIK or maybe cosmetic surgery. A lot of those types of practices will offer loans because there's high balances on those services, and people just can't shell out thousands and thousands of dollars. But hospitals in the past had not offered those types of loans. But these organizations like Clear Balance are kind of moving toward that, and offering these lower interest rate or even zero interest rate loans to patients, to especially in the advent of the high deductible health plan realm, to help patients pay off those big balances. So just a bit of information to help understanding in that with that particular concept. So a few questions to go over. I have 3 of them from the quiz. The first one: which of the following is an advantage of having an internal control system? So the answers, there were 2 main answers given. It gives employees direction through policies and procedures, and it reduces the risk of losing assets through errors. And then there was an option that said choices A and B, and then an option that said none of the above. So the correct answer was choices A and B. And typically most folks that got it wrong chose it reduces the risk of losing assets through errors. Now if you looked, I don't have the text here with me, but if you looked further through the text, when there was actually an internal control system checklist and whatnot, where it talked a lot about procedures, etc. And really what an internal control system is a series of policies and procedures, checks and balances within an organization. And what an internal auditor, internal control kind of check person will come in, will check through those policies and procedures to make sure that those checks and balances are in place. So really what internal control is, it are those policies and procedures to make sure that all of those checks and balances are in place. So it does both give employees direction through those policies and procedures, but it also reduces the risk of losing assets through errors. So the correct answer in this case was choices A and B. The next one, which of the following is a reason why a hospital may not always collect money due at the time of service? So the answers were hospital policy does not allow money to be collected at the time of service. Collection of money at the time of service may be considered poor public relations. The total amount of money owed may not be known at the time of service, or all of the above. And the answer was all of the above. So all of those things may come into play. Sometimes hospitals do not allow money to be collected at the time of service. A lot of times you think about going into the hospital and you may come into a registration area. It's a big open area, maybe right at the front of the hospital. It's just not an appropriate place to be collecting money. Oftentimes you'll have registration and the cashier is in an entirely different place. Finance and registration are often not the same department. So that particular hospital may not allow registration to collect money. In some other hospitals, registration may collect copays. So it all depends on the hospital policy. Other hospitals may just say, we don't want, from a public relations standpoint, we don't want to collect money at the time of service. There are some places that feel that is the appropriate thing to do. From a true bottom line standpoint, if you know that that patient has a $25 or $50 copay for that x-ray or whatever it might be, it probably makes more sense to collect it when the patient is there rather than chase it down and go through the expense of sending out a bill and whatnot. But there are many that feel that from a public relations standpoint, they'd just rather not collect it then. But then a lot of the time, especially in the hospital environment, the total amount of money is just not known at the time of service. A lot of patients may have just a percentage copayment or percentage coinsurance as opposed to a flat copayment like we may have when we go to the doctor. So that is oftentimes we just don't know exactly what's going to be owed. So that's oftentimes the case. So in this case, all of those were correct. So our answer was all the above. So the last one, when an organization factors its accounts receivables, the organization, there were 4 different answers, but our correct answer was sells its receivables to a bank or other agency at a discount. So this is what I was talking about when we were talking about the Clear Balance organization. So like Clear Balance is a bank, a financier that's coming in to offer loans to patients. So they're not buying accounts from the hospital. They're just saying, hey patient, you owe $5,000. Did you want to take out a loan for that? And managing it that way, as opposed to in this case where when an organization factors its accounts receivables, that organization is selling those receivables to a bank or sometimes to law firms. Law firms will oftentimes, and I'm not really sure why, it's not ever made a lot of sense to me, but it's sometimes law firms will manage collections. That's a specific type of law firm that does that, but law firms will manage collections, and so they'll sell the AR, the overdue AR, accounts receivable, to this outside agency at a discount. So they'll sell it to them at 50 cents on the dollar, whatever it happens to be, and then they'll attempt to collect those dollars. So whatever they can get for that, their hope is they'll get it for more than what they bought it for. the collection agency, and then obviously the hospital has already gotten their cash, so it works out better for them in the long run. So it's a way for hospitals to get that cash on the books right away so they can continue to operate. The bad thing for patients in that regard is that now they're being chased by a collection agent, which is not always great from a PR standpoint for the hospital, because it does, they don't always see it as, you know, they may see that collection agent as an extension of the hospital, and sometimes the tactics that a collection agency will take to collect money are much less positive than if the hospital is just calling, maybe every, uh, you know, 15 days or whatever to say, hey, you owe this money to the hospital. Obviously, I think most of us have probably dealt with that at one point in our life or another, either personally, I know I have personally, so I guess I can't speak for everyone else, or at least maybe received a call to your home. I know we get that quite a bit, just as maybe received a call here because there was a wrong number or something, trying to reach someone that has an overdue bill of something, maybe a credit card or a medical bill or something. So collection agents, although it's a job and everyone has to do a job, sometimes they can be a little more aggressive than if it was just the hospital calling. So it does give a bad look to a facility sometimes if they do have to go that factoring approach. So it's always better if they don't have to, but sometimes they really do need to bring that money in and factor their accounts. And so it's just sometimes the way you have to go, especially if you have a large group of bad debt. So sometimes that's just the approach you need to take. So that's all I have for this week. If anyone has any questions, let me know. Hopefully everyone, I just sent out an email for everyone to attend tonight's session as well as tomorrow morning. And then we'll be attending the AUPHA conference, which is it's kind of the health administration annual meeting for all health administration faculty. We will be defending our certification, which is our kind of our accreditation for our bachelor's program. We will be doing that on Wednesday morning, and so hopefully we will walk away with a certification for our program, which we've been working very hard on for quite a while. So we'll be down there this week. I'll be attending meetings during the day and busy at work at night. But no worries. Obviously I'll be around and available to everyone also. So if anyone has any questions, please let me know. And I can't believe we're at week 7. It seems like we just got started. So I'm looking forward to chatting with everyone over the next couple days live in person, and then working with everyone in the discussions this week. Okay, thanks so much.